Hello and welcome to Athletic Therapy Now, a podcast for athletic therapists by an athletic therapist. My name is Ashley Burr and I will be your host. Thank you for joining us today. Hello and welcome to Athletic Therapy Now. Tonight is episode 23 and we have Dr. Christopher Notley with us. Dr. Christopher Notley has been a dedicated healthcare professional in Manitoba since 2000 with a focus on helping patients manage headaches, neck pain, and low back pain, as well as injury rehabilitation and performance involvement. He earned his Bachelor of Physical Education from the University of Manitoba in 1997, where he began his athletic therapy internship. He became a certified athletic therapist in 2000 and a certified strength and conditioning specialist the following year. Dr. Notley has worked with athletes at provincial, national, and international levels, as well as the general public, helping individuals recover from injuries and improve physical function. He also spent 5 years as an anatomy instructor at the Professional Institute of Massage Therapy, sharing his knowledge with future healthcare professionals. After working in multidisciplinary clinics in and around Winnipeg, Dr. Notley decided to expand his skill set to provide more comprehensive care. In 2005, he began his Doctor of Chiropractic studies at Northwestern Health Sciences University, graduating summa cum laude in 2008, and has since continued his professional development by training in active release technique, earning certification in acupuncture, and becoming qualified to teach hardstyle kettlebell training. With a multidisciplinary approach, Dr. Notley focuses on providing individualized care to help patients manage pain, recover from injuries, and maintain long-term well-being. He conducts through assessments, explains conditions clearly, and offers honest guidance, whether through treatment or by referring patients to the appropriate resources. So thank you for coming on tonight.
Thank you for inviting me.
I always like to start off by asking guests to share what their favorite thing is about being an athletic therapist.
Well, for one, athletic therapy is what made me what I am today. But I think probably one of the biggest things is helping people. When you go through a bad day and things don't feel like they're going right, and then that one person walks in who came in not too long before, maybe a couple weeks before, and they come in and they say they're feeling so much better. All that bad stuff that happens throughout the day, it really doesn't matter anymore, and it just makes you go, "Yep, I'm in the right place." So yeah, that's probably the most enjoyable part about being an athletic therapist is helping people.
Totally understand. It's very, very rewarding to have that, what I'm doing is actually helping and there's a purpose with this.
Absolutely.
Yeah. So, we've chatted a lot through social media, I think is how we first kind of started getting in contact with each other, just following each other on Instagram and commenting back and forth on
Yep.
posts. And I first found you as a chiropractor and found out that you're also a certified athletic therapist. So you hold both these certifications, the Certified Athletic Therapy and the Doctorate of Chiropractic. Could you share your professional journey, including the factors that influenced your decision to pursue chiropractic after obtaining your athletic therapy certification?
Oh, absolutely. I've told this story to I don't know how many people. So when I was an athletic therapist, I remember telling a patient, "You don't need to go see a chiropractor. The muscles are why the joints aren't moving well. Like we work on the muscles, everything will get better." Well, that's obviously it's changed. I have a different philosophy. But I would never have been a chiropractor if I didn't miss out on a vacation. She was my girlfriend at the time, but my wife now. We were supposed to go out west, and I took the whole week off, going to finally get a vacation, and it all fell through. And so I thought, well, what am I going to do? I can't just like go back to work because nobody's coming in. They've all scheduled for the following week. So I went and visited my mentor, John Hayward, who, after him being my mentor, he actually went on taught at the U of M for I don't know how many years. And I went to visit him, and he said to me, he's like, "I was just going to call you. I'm getting a surgery done, and I'm going to be away for 6 weeks. Can you do some of my hours?" So I started to work with him. Well, it just so happens he was working alongside chiropractors. At that point in time, it was Ellis Chiropractic. And that ultimately led to me not just doing those 6 weeks, but then following him to Ellis Chiropractic's new office, which is Spectrum Health Center. And from there, I met another chiropractor who introduced me to another chiropractor who is currently the chiropractor for the Jets and Bombers and the Valor. And I started working in his clinic. So I was working out in Selkirk at All Sport Athletic Therapy Services. I was working at Spectrum Health Center, and then I was working at Team Chiropractic. Uh, and I was teaching. And despite all of this, I wasn't making a great living. I was still living with my parents. I was probably making about $22,000 a year. I'm sure there were some months where I went, "Oh, great! I would have been able to pay for rent, but no food or anything like that." So I was working on a patient one day. Already at this point in time, I was thinking I need a 5-year plan. This is probably about second year in. I'm like, I need a 5-year plan. And so it was either I was going to go back to school and get my master's, or I had to figure out what else I was going to do. And so I was working with one of the patients in the office, and I was working on her neck, massaging her neck for probably about a half an hour, and things weren't loosening up. I was like, this is taking forever. But as I was feeling around and going, wow, this joint feels a little bit tight. So I went to the chiropractor. He came in. He's like, yep, sure enough, it is. So he adjusted the patient and everything loosened up. And I'm thinking, I can do that. Like, that's pretty straightforward. And that's when I realized that, I have to have this 5-year plan. I got to do something. And this is what I'm going to do. And I realized that it was an excellent complement to what I was already doing. And so the reason I became a chiropractor is because I was a little stubborn, thinking, well, I can do that too. I just have to learn it. And that's how I decided to go into chiropractic school.
That's a great story. I love that I mean, we all struggle with that, the financial side of it as we're getting into AT. I think it's becoming a little bit better now because it's more established than it was in 2000. Was that when you
2000, yeah.
certified? Yeah, well, significantly more. I mean, it's 25 years, right? Um, but then there's still we come across a client where we just can't figure it out. We can't figure it out, and we find somebody who can, and either it's, your experience was with a chiropractor where they did an adjustment and that was just this like wow moment for you. And I think
Mm-hmm.
it's those wow moments that really push us into pursuing additional education, whether it's, like yourself, where you took an entire different university degree, or looking into different continuing education courses if those are what gives us those wow moments. So that's really cool. I like that. Um, and how I'm just gonna continue off of that there. On to our next question, which is how do you find that being an AT and being a chiropractor, how do those complement each other in your practice?
Well, as I said, I think they totally complement each other. Chiropractic is mostly known for its manipulation. Obviously, we learn some soft tissue stuff as well. And we know both of those methods. And when I say soft tissue style, that could be anything. That could be grafting, that could be cupping, that can be uh, ART, whatever it might be. We know that those things can help desensitize people and allow them to move better, open up that door so they can do more. The exercise component, understanding, not only just understanding exercises like, oh, your neck hurts, so let's stretch it. It's understanding where they need to be in their daily life. So when we talk about athletes, and that's obviously where I think I understand it better than no, I'm not going to sound cocky there. Uh, that I understand sports to a good degree. I can now say, okay, yeah, we need to do this, but for you to be able to do that sport, I need you to be able to accomplish this and understanding it. And I've had numerous patients come in to see me saying to me, this, what's great about coming to see you is you understand what I'm talking about. And I always do my best when there is a new sport that I've never seen before, is I try to understand it better. You start learning the lingo and the terms and how it should be played and getting a better feel for it. And again, because of my athletic therapy background, that's easily comes into play. So really, if you saw me in my office, you're going to see me doing some type of soft tissue work, manipulation if it's needed, and then giving the appropriate exercises for people to either get them out of pain or progress them into back to the sport that they want to get into, or back to the job that they want to be able to do. So it's a perfect mix.
How do you know, do you bill as an athletic therapist ever, or do you just strictly focus on the chiropractic?
It depends. More often than not, probably, and I don't know the numbers, but I would say probably about 99 to 90% of the time, it's going to be chiropractic. Uh, for the most part, that's because of insurance. Most people are coming to see me as a chiropractor as well. Uh, just I'm in a chiropractic office. That's what people think of first. They're coming to see me for that. But insurance is probably the biggest thing. When they have a really good coverage for chiropractic, but have very poor athletic therapy, they have that opportunity to still get the same type of care, almost the same type of care. The only difference is when I do athletic therapy, I don't manipulate.
Yeah,
I
because I think,
just
sorry,
yeah,
there's a
go ahead.
lag. I was going to say, I know there's no, when I redid my insurance this year for athletic therapy, there was no mention of, holding a second designation in chiropractic. But when you hold a second designation in massage or in osteopathy, there has to be a certain percentage split to be able to bill on one versus the other. But I mean, I also work in a chiropractic clinic, and the chiropractors I work with, they also do exercise and some of those soft tissue techniques. And so there's so much crossover
There is.
between AT and chiro that I feel like the only kind of, not the, I'm using quotation marks here, but the only big difference is that manipulation of the joints. Am I wrong in that?
That's how I treat it. Absolutely. I think over the years, all the professions are starting to look the same. People are looking at physio and athletic therapy, going, well, what's the difference? That's been going on for years. But chiropractors who are um, pursuing more knowledge and trying to help their patients, and they start looking at things like, well, how do I do better at taking care of my patients with their back pain? They're going to discover that exercise is part of that. And so if you want to use appropriate evidence, you have to accept that. So yes, it's very, very similar. The biggest difference is going to be the manipulation. And like I said, the only time I don't bill, if I bill somebody for athletic therapy, I don't manipulate, because I never pursued that part of it. Like, well, there wasn't an option for me to do that with the insurance company. And so just in case, I thought, I'll leave that out, because if anything did happen, if I were to manipulate somebody and for whatever reason, the rare occurrence of a rib fracture or something like that, they'd be questioning me going, well, how come you adjusted this person? The athletic therapists aren't covered for that. And I'd be going, well, I'm a chiro, but the bill doesn't say that. So
Yeah.
just to be safe,
Yeah,
I just
absolutely.
eliminate it. That's probably the biggest difference. So there's times where I have patients who might run out of chiro. And then I'll say, okay, I'm switching over towards athletic therapy. The only thing I can't do is that. There was a point in time where I did use to manipulate, but I got a little extra knowledge from the CATA, and I went, okay, I'll do it right and just protect myself, and yeah, just that's the only difference when it comes to billing patients.
Yeah, it's interesting when we really get into the nitty-gritty side of it, and you had said there's that, there's always that question between what's AT and what's physio and what's the difference, and it gets really confusing. And I mean, I always say that it's at the base, at the very core base of what we are between AT and PT, it's very similar. And the biggest difference when you truly get into it and you start going to see a therapist is in the continuing education. That's the difference from one therapist to another, is what their continuing education is, because you could see a physio that has a really big sports background and exercise background, and you could see an athletic therapist that has a background in a little bit more of the, let's say, um, neurological or any of the other things that you would see a physio for. But I also like to say, and this is I'm taking this from a podcast that I was listening to the Bone with Shelby Daly in the United States. One of the episodes she was talking about how, or her guest was talking about how athletic therapy or athletic training in the States is really like a mixed martial arts. It's the mixed martial arts of therapy, where it's a little bit of everything pulled into just this one healthcare
Interesting.
practitioner. And I like
So
it.
so my quick answer is that we're smarter and better looking. So I got that from John Hayward. He told me that years ago. I still use it to this day. How I actually explain it is that I look at where they come from. And the physios, their original, like they started like during the World Wars. So they were there for musculoskeletal injuries. They may have amputees, burn victims, quadriplegics, something with cardiorespiratory issues. And so they were like taking care of all those people in the hospitals. Whereas athletic therapy started in sports. Started with the sports teams. Now, when you leave that environment and you end up in the general public, most people are not getting the cardio, the neuro, they're not getting the amp, they're getting all that stuff done in the hospital, but they are getting musculoskeletal. And well, obviously athletic therapy being in the sports, we're musculoskeletal like to our core. That is what we do. I still think we're the experts when it comes to that.
Yeah, I agree.
When we leave the teams and we end up in the public, what do we see? Musculoskeletal. So that's why we all look the same, because we're treating the same stuff. And like I said earlier, if we're doing evidence-based type of care, it's definitely going to start looking similar to each other.
Yeah.
That's my long answer. I prefer my short one.
Yeah, it's good, and I mean, they sound very similar, our answers, and I think they are, and it's really just it comes down to what setting you're in, right? Yeah. So, when you have you encountered any challenges or obstacles in maintaining that dual certification as an AT and a chiropractor, outside of that, what we've just discussed about manipulations and when you can and can't do them, and how have you navigated them?
There really hasn't been much when it comes to maintaining. Sadly, in Manitoba, we don't require any continuing ed in chiropractic, through our chiropractic association. I'm sure at some point in time that will change. Um, but really, it's musculoskeletal stuff. So if I want to take a course, if I want to take a course in pelvic floor stuff or acupuncture or whatever it is, it's all the same stuff. So if I take something for athletic therapy, it's going for I'm continuing it's continuing ed for chiro as well. I think the biggest thing that's difficult for any of us is just the cost of doing these courses, especially not so much when they're in the city, but especially when it's like you've got to travel down to whatever to Minneapolis, which it costs you a certain much amount to get there. You have to take time off to do it. So you're losing income there because you're not seeing your patients. In my case, I work on Saturdays, so most courses are on weekends. So I have to take one of my busiest days off just so one of my busy days of work to take it off. So I lose all that and travel and food and lodging, all those things. That's probably the most difficult thing. So in my case, I try and take courses that are in the city. Um, I take as many free online courses as I can. I don't even remember what BASRAT stands for, but that's what I call it. They have their courses. They're out in Europe. It's like an athletic therapy type of program, and they talk about stuff. I think it's almost every month. There's an hour webinar, and I use that for continuing ed credits.
What is it
Um,
called?
BASRAT. I can't tell you right off the bat what that stands for, but it's over in Europe, and I think at the end of this month they have a course that's on something. Again, it's just an hour's worth of your time, but I'll do that every time it pops up. I'm taking one. Um, anytime there's a course here that I think is going to be a benefit for me, and I feeling like I can afford to take it, I'll take it. And then with the CATA, we get continuing ed credits for being part of their AGM or annual members meeting, even though that's just they've kind of changed that a little bit. We don't get as many points as we would have before. I do as much as I could, and then up until recently, when CATA didn't require us to be part of a provincial program, I was going to the AGM for that as well. All of those accumulate your continuing ed credits. So it helps. And then I'll do an online course if I can, through whatever I can, as long as it's online. That's so I do my best to not have to spend so much when it comes to that. And it makes it a lot easier. You don't have to worry about the costs of maintaining your certification. And I'm always learning stuff. If you've looked at my Instagram feed, most of my feed is research based. I've done far less videos of myself and a far more image-based stuff just to educate people. And I think that comes down to me having been a teacher before, me having parents that were teachers. So always willing to teach people. And it teaches myself too when I do that, look at that research.
I love your social media. You put so much out there, and I mean, if you want videos, just go to your YouTube page because you have so many videos up there, and yeah, your Instagram is very, very research based, and I think that's fantastic. I often am reading through your stuff, so it's great. You had made a comment there about the MATA AGM. I think going forward we'll be able to collect CEUs for the MATA AGM
It
because
makes sense.
well, so yes, it makes sense. The CATA requires you to be an accredited, um, not accredited member, accredited instructor in order to get 0.4 CEUs per hour.
Okay, yeah.
So the MATA I've noticed that they've actually popped up on the accredited program page. So I think that AGMs and any of the webinars that they run going forward will come with those 0.4 CEUs per hour. You still get 0.2 CEUs for anything that's going to further your education. So say if somebody's listening to this podcast and it's 30 minutes and they'll get 0.1. If it's 60 minutes, then they'll get 0.2 CEUs.
So how do you prove that?
I asked, CATA says you just have to enter it in that you've listened to it.
Oh, wow.
Yeah,
I never knew that. Okay.
In some ways, they made it like slightly more difficult to get higher CEUs because it is a challenge to be an accredited instructor through the CATA. It's very expensive to do that because you're paying a profit, like a percentage. You're paying a percentage to the CATA in order to be an accredited instructor or whatever they call it. But on the other side of it, it opens it up for a lot more because previously you could only have, I think, 14 CEUs that were not approved instructors. And now it's
I probably use
unlimited.
most of those.
Yeah, well, now it's unlimited. It's just that you get 0.2 per hour instead of 0.4. So,
Okay.
for those of us that like to listen to the podcasts and do courses like the BASRAT or, I mean, most of the courses that I take have never been CEU approved. They've always been
Yeah.
through other programs, right? So,
Up until recently with the ART wasn't even part of that until just recently. So
yeah, don't quote me on it. I mean, I could be wrong on it, but I did check about most of that, and I believe it's accurate. So,
interesting. Well, I can ask him if I'm going to use that.
yeah, it's I had some people submit last year for the last submitting season for the podcast, and it went through. And I mean, they
Interesting.
weren't audited, but it did go through.
I got
And
audited once.
did you? How did that go?
Yeah. It was so easy because they audited me while I was in chiropractic school. So I'd already
Yeah.
had the approval from them, which I thought was kind of useless to audit me. They could have just looked at their own records and went, okay, he's good.
Moving on. Yeah.
Yep.
I'm sure it's random, right? Like,
Yeah.
yeah, picking names out of a hat. Um, So sorry, coming back onto that, the biggest challenge that you're finding is getting all the CEUs that you need and keeping the costs low, because you can easily
Absolutely.
spend thousands of dollars a
Yeah, and
year.
to me that it almost feels like a tax for our like free is it's almost or a tax or an extra membership fee just so that you can have it. Though I think it's important for us to continue to be learning. I also feel like, and like, for example, like an ART course, you're talking thousands of dollars, and really does that feels like the only way you're going to keep your certification if you pay more money into things. I don't
Yeah.
know. I think we could probably do it in a better way, but uh, yeah, I don't. That's the only part I really don't like, and that's why I try and keep it as cheap as possible.
Yeah, I found when I did my acupuncture, um, I mean, it was almost $4,000 for the course. I also work weekends, and so I was missing weekends to go and do that. And so not only was I paying $4,000 into a CEU course that I couldn't even claim all the CEUs for, I still had to take courses on top of that to get my CEUs, because it was not fully approved. Um, I had to, like you, miss out on 6 of my most busiest days, just to be able to get my CEUs. It was tough. I found that was tough and frustrating too.
Mhm.
But yeah, there's lots of free CEU options out there, and I'm glad that you brought up the BASRAT. That'll be something good to look into, for myself, and also just for anybody out there listening who's looking for CEUs that, aren't going to cost an arm and a leg.
And typically they're on at around 1 o'clock. So depending on your work schedule, it works okay. Um, so that's pretty good. And you'll get a certificate for it too. So you'll have proof that you as long as you were there, you'll get proof that you actually attended.
Yeah, that's great. Um, so for athletic therapists that are considering pursuing a dual certification in athletic therapy and chiropractic, what advice, or recommendations do you have to offer based off of your own experiences?
Oh, well, it's expensive. I don't know how much it is to do it in Canada, but and I'll have to use my example was when I was in school, so 2005 to 2009. So things have changed since then. It's become more expensive. My program that I was in was uh, 10, 10 trimesters over the course of 3 1/3 years. Each trimester at that point in time was about 8,000. Now it's about 10,000. I was lucky back then. The Canadian dollar was stronger than it is now. I think we were at about 86 cents. And we actually went to par during that time. So it wasn't as hard of a hit. But you have to consider how much that's going to cost for the course, especially if you're going down to the States. Canada, it is harder to get into. There's only one English speaking school and one French speaking school. So you have that, you're limited as to how many people can get into that. Whereas if you go down to the States, there's lots of different programs that you can look at. The biggest thing is it's not cheap, and you're coming in as a Canadian. If you're going down to the States, you're going to be spending, well, if it was $100,000 American, you're spending a lot more, and then you have all those other life expenses. I actually went down. My wife was with me when we went down, so there was two, and then there was a kid that came during that time. Um, the other thing that we should be considering is, well, another thing to realize is that as an athletic therapist, if you're going into the program, you have a leg up, especially if you got some experience. You've got a leg up. You understand the musculoskeletal stuff really well. You'll learn more because even the anatomy that I learned more than the anatomy that I learned when I was in my phys ed degree. Uh, but you will have a leg up on all the physiological therapeutic courses, the musculoskeletal based courses, maybe even the neuro courses. So you'll do okay in the academic side, but like I said, I think it's probably the cost is the biggest thing. Another thing to realize is that when you're going to this program, it can be part-time. Most people do it full-time, and it's like an 8 to 5 day. So you have a full day of school. It's like you're going to work. Uh, and when it comes to certifying or finishing off your schooling and being able to practice, if you're going to come back to Canada, you have to realize that you have to take the Canadian boards. And if you choose that you're going to practice in the States, you have to do the American boards. For somebody coming from the States, coming up to Canada, having been taught differently in the States, the Canadian exam is definitely harder because you're used to certain question style, a certain expectation, and there, in my opinion, there's a higher expectation when you come to the Canadian side. It was definitely more difficult, but if you are a good student, if you're coming into the course with good grades, you will probably finish the program with good grades, and you'll do well at passing the exam. If you were in Canada and you take the Canadian boards, you'll be prepared for that. If you go down to the American boards, I think they were easier. So if you're a Canadian deciding to practice down in the States, that part of it won't be, I don't think it will be as difficult. A little bit of a bias, but yeah.
Well, and has that changed over the last little while? Are the
I,
exams kind of the same?
I don't know, but that's as best as I can say. Our Canadian boards are created by a group of people who are not associated with the universities. Whereas in the States, the members of that group that creates the exams is made up of of people who are instructors at the universities. To me, that creates a little bit of the ability to teach for the test rather than teach to learn. Whereas in the Canadian boards, they know what it's going to look like because there's been enough people who have seen it so that they can figure out what type of questions are going to be used, but they have to teach them so they can be prepared for that. Whereas I had classes where we learned about neuralgia paresthetica 3 times in 3 different courses. Sure enough, I got to the exam, 2 different exams, and they both had the same question in it. So they knew that question was going to be in there, so they prepped us for the exam. I don't agree with that. I'd rather be able to know my stuff and be challenged. And I think the Canadian boards are definitely more challenging in that fashion.
Yeah.
Yeah.
That reminds me of I had my like high school math provincial test or something like that where it was made up of by it wasn't made up by the teacher, it was made up by the province. And I
Mm-hmm.
remember showing up for the day of my exam and my teacher goes, "There's a test or a question on the test and we didn't learn it." So she spends, a quick 5 minutes teaching me how to do this question. And I'm like, that feels like cheating. Like I know it's not because you never taught it and you didn't think you
Yeah,
needed to
yeah.
teach it, but like going into this immediately before I walk into the exam, yeah, I don't know.
I walked into my Canadian boards, like the practical, and we didn't have that experience. We didn't. The only practical experience I have for a practical exam was the Canadian boards. So at least I had that. The people that came with me, they didn't have that. They didn't have that exposure. But one guy's like, okay, so when you're gonna set them up to adjust, if they start having symptoms, stop. Like it's adjusting the neck. And it was like if all of a sudden they started having neurological symptoms, it's like, no, we're not going to adjust. We're going to, you know, go down in that direction. We never got exposed to that. So thankfully I had somebody a few minutes before tell me that. I'm like, okay. And sure enough, we saw it in there. But it's to be expected. Like obviously they do it in a bunch of their tests too. And so it's probably why they knew. But other
Yeah.
than that, I mean, even if you didn't know the answer and somebody said, this is what we need to know, you still have to answer it. So
Yeah.
yeah,
And you said there your only experience was with the Canadian exams. You mean athletic therapy? Like your
the
athletic
Canadian,
therapy
yeah, my
practicum?
my my practical experience was the Canadian one way back in
Yeah.
'99. So
Yeah. Yeah, the I found the athletic therapy exam, like the practical exam, to be probably one of the most terrifying exams I've ever done.
oh really?
Yeah.
Um, yeah, I'll tell you my story. I am prone to be very anxious, and it usually goes to my insides if I'm nervous.
Oh
And
no.
so we went to Montreal for our practical exam, and um, that night, right before the exam, about 4 o'clock in the morning, I woke up and my stomach was just in a knot. I'd been woken up because one of the students was getting ready to do his exam and like early in the morning, and so I couldn't get back to sleep. I'm just like crumpled in a ball, sweating profusely. I'm sure I was pale, couldn't tell, but I was so nervous. And for me, I'm not much of a music person, but when I listen to Great Big Sea, all of a sudden
How very
I'm calm.
Canadian of you.
Yeah, exactly. But that just calmed me, and it still does to this day, actually. I don't know why. It's really like, high-end
Upbeat.
music. It's
Yeah.
yeah, upbeat. It's not something just to relax me, but it did. It relaxed me. And we're at the exam, we're in the green room just kind of waiting, and it's silent. Like a pin could drop and you'd hear it. And somebody who was helping out with the exam, she came in and like, wow, you guys are so calm. And I'm not the one to speak up, but there I was, like, low tone. I'm like, you have no idea. And the whole place burst into laughter. Thankfully, that helped everybody. Um, and I ended up passing that exam, thinking after finishing it, thinking that I failed all sections, but I passed it. Since then, I got married and I didn't even feel that nervous. So having had that worst pain ever and being that nervous taught me to say, hey, you know what? I can handle the tough stuff. And so when I did my American board or Canadian boards for chiropractic, um, I was far less nervous, and I didn't have to worry about anxiety and gut
Yeah.
issues.
I failed my practical exam the first way through. And I mean, outwardly I blame it on the fact that a fire alarm went off in the middle of my exam. Um, but inwardly I also know that if I knew my stuff well enough, if I knew it, like really knew it to the core, then having the fire alarm go off would not have affected it. Um, I think it was I was distracted because of it, but that shouldn't be the thing that distracts me. And I'm grateful that I failed it the first time around because I think I became a better therapist by having to repeat it. But I just like I remember it, and I remember the moment I realized I failed. I was because you had back then it was um, five different practical scenarios, and I was doing my emergency scenario, and I went through it and I called an ambulance, and I was feeling super confident. And I was on to a second scenario, and I was doing I can't even remember what the second scenario was. I just remember I had to pull the guy's shirt up to look at their abdomen. Maybe I was doing like a hip wrap or a groin wrap, and all of a sudden there was bruising on their abdomen. And I was like, oh shit, that was from my emergency scenario, and I didn't lift your shirt up and expose the area to find out that you had internal bleeding.
Oh
And right
wow.
there, I knew I failed. Middle of my exam, I'm sitting there and I'm like, I just failed.
Now,
Like,
when you guys do your exam, is it just like we had clinical and field? Is it still that same way where it was broken up into two and you could pass one and fail the other, or is if you fail, you fail?
it was broken up into two, and if you failed any part, I believe if you fail any part of the field exam, you fail the field exam.
Okay.
You have to get an average of like 80% or something like that. But the clinical was a separate exam. So you had your
Okay.
three exams, your written, your field, your clinical. Now now there's only a written exam. So
Oh, right.
the clinical and field practical exams are on the onus of the university.
Right.
And I've sat in on the U of W ones, and they're very, very similar, I believe, to what the CATA exam used to be
Okay.
like. But it's really on the onus of the universities. And then the written exam is still, I believe, the same, like what it was at 300 multiple choice questions for
Okay.
three
Yeah.
hours or something like that. Still, like, it's pretty intense. 300 questions in 3 hours
Yeah.
is a lot. If that's what it is, maybe I'm wrong. Does that sound right?
I don't know. I took that in 99. I'm sure
So
it's changed.
were you one of the first kind of groups of people to go through the CATA exam?
Nope.
Because when did
The
that come
first
up?
the first to actually become certified as as athletic therapist, I don't know if it was the exam though, was actually Glenn Bergeron was one of the
Hmm.
first ever. I certified when I first certified in 2000, I went to the AGM out in Niagara Falls. And they're like, "Oh, we're going to celebrate the first ever people who actually certified." And Glenn was one of them. I'm thinking, I'm 25 years old. This guy's been already practicing 25 years. And now, I don't know if he's retired now. I think he's like semi-retired right now. No? So we're talking 50 years. So anyways, yeah, I mean, he would have been the first. Prior to me, the people that I shadowed or worked with different teams, their exam was way tougher. They actually got grilled during their exam. So if they were doing like a test, they would get grilled while they're doing the test, and they would purposely try to get you to answer. And if you're going in the wrong direction, they'll make you go down the rabbit hole in the wrong direction. And that was very tough. I'm very thankful we didn't have that. So and it was far less intrusive. You did your job, you did what you had to do, and you didn't have, they would ask questions afterwards. I appreciated that. But yeah, I was happy. I don't think I would have passed the first time. Uh, yeah, the first time that if I had done that style.
Okay. Yeah, because it's okay. So I just had an episode with Glenn Bergeron come out actually this morning
Huh.
on the history of athletic therapy in Canada. And we spoke with myself and Shelby Daly did like a co-hosting podcast with him to go through that. And um, I thought he had said, and now I'll need to go back to my notes, and they're not in my room with me here. But I thought he had said something had happened in 1999 to work on progressing the athletic therapy program. And I thought it was the exams, but maybe it was Sheraton College opening.
It could be something along those lines, because when I was doing my internship, because I wasn't part of the university program. While I was in that internship, the university program started.
Mm.
So it could have been around 98, 99 that at least the U of M's program was up and running. U of W would have been in, I'm guessing, 96, in and around there. So when I started the athletic therapy program in my last year, so it would have been 96, 97. And Glenn left to the U of W after interviewing me, like just before school started. We got a letter because you don't get email back then. Um, he uh, he said, I'm going over to the UW. You guys, if you are still interested, you can come over and do the program there, which I think wouldn't have been a university program, was probably still an internship. I'm not certain. I decided to actually stay at the U of M, and that's because I live like 7 minutes away from the U of M, and yeah, there was no sense in me changing universities for that reason. But yeah,
I'm just
during that time there was a change.
I'm just doing a quick Google search here. And I feel like I should know this. I just talked with Glenn on Friday. I think it was Friday, and then I listened to the podcast this morning. The first CATA exam was in 1975, and Glenn Bergeron actually just got his 50th anniversary plaque. It's like a thank you
Yeah,
for being part of the CATA for 50 years. So
yeah.
that's really cool. And then the University of Winnipeg opened their program in 1998.
Okay. Yep. Sounds right.
Yeah. History. I'm terrible with remembering the years. I'm terrible at dates,
I'm only
but
basing it around my time frame. That's all I can say. And then the only reason I knew that he had been certified as long as he was just because I thought he certified when I was born. I mean, that's something.
yeah, there you go. You just aged yourself there.
That's okay. I'm coming to grips that I'm going to be 50 this year. So
That's good. 50 years young.
yeah, at least up here.
Yeah. I'm going to go through a quick summary of everything we talked about, and if there's anything else that pops up, just let me know, and we can add that in. So we started off by talking about how you hold both the designations for athletic therapy and chiropractic, and kind of talking about how you got into that and what your journey was, and you're talking about how you were going to go on this vacation and it fell through, so you ended up talking with your mentor at the time, or one of your mentors, John Hayward, and he was asking you to pick up some clients while he was on a leave, and so you did that, and it was in a chiro clinic. So you started experiencing what it was like to work with chiropractors, and you worked with quite a few different chiropractors and a couple of different clinics, and then you had this one client where the neck pain just wouldn't go away, neck tension, sorry, and so you consulted the chiropractor, and they did an adjustment, and all of a sudden you just saw these changes, and that was your big kind of wow moment where you just kind of said, like, this is this is something that I want to do. I could do this. I could learn this. I could do it. At the same time, you had gotten into this feeling like you needed to make more money, but you couldn't figure out how to make more money as an AT, because it wasn't working out at that time, um, the way that you were running your practice. And so it sounds like adding in that chiropractic was a way to reach your goals with your 5-year plan. And that 5-year plan was completing the chiropractic certification or chiropractic exams. Um, and and through that, we got into talking about the difference between chiropractic and AT, and really it's very, very similar. And again, we talk about, the mixed martial arts of athletic therapy, and how, athletic therapy is very well versed in sports and return to sport and return to activity, return to our work. And the biggest difference between chiro and AT is that with chiropractic, you can manipulate. And you can't do that with athletic therapy. So even though you hold both designations, and you work very similar with both your AT and your chiropractic clients, the biggest difference is if you're going to manipulate, it's got to be chiropractic because your insurance dictates that. And then, you also said that ATs are the smarter and better looking group. So, I'm going to go with that one too.
Yep, yep.
And then we got into talking about what challenges or obstacles have you faced. And it really wasn't specifically just chiropractic challenges, it was generally challenges that you faced as a practitioner in healthcare. And that was, getting through the continuing education courses that we need to have in order to maintain our certification. And because there's a high cost to it, and time, a lot of cost, a lot of time, taking time away from working with clients, and I think you alluded to this, but also taking time away from your family. And so some of those solutions that you've come up with is finding a lot of those free courses and attending the AGMs and attending the meetings, and BASRAT has some continuing education courses. So that's BASRAT. It's online, usually around 1 in the afternoon. But right after this, I'm going to go and look that up, and I might attach that in the show notes here. And then we got into talking about some recommendations that you would have if an athletic therapist listening to this was interested in pursuing chiropractic in addition to their AT. And so you had said, be prepared that there's going to be a large cost to it. I think you said $10,000 per trimester, and there's 10 trimesters, and that's a huge amount. And so be prepared for that. And then, the positive side of it though is that as an athletic therapist, you'll have a leg up going into chiropractic school because you already know your MSK. You have a good understanding of it. You have a good understanding of what, a practical exam is going to look like. And, coming back into Canada, you're likely doing a practical exam, and that might be your first experience if you go into the US for schooling. And then you also mentioned that you can do it part-time, but most people will do the schooling full-time. And I think did that sum up everything there?
Yeah, I think so. Yeah.
I think so.
I think the only thing I would add, especially for the last part, is being a chiropractor has its good parts and its bad parts. We obviously have our fans who absolutely love what we do, and like any profession does. But we also have a lot of detractors, both the public and other healthcare professionals. Um, and you have to be a little bit, not a little bit, you have to have thicker skin to understand that there's going to be people who are going to be against what you do, even though you are providing, evidence-based care, that you're helping your patients and you're treating your patients appropriately. There's always going to be people who are going to look at you and think, oh, you're a chiropractor. I mean, mind you, there's the other way. It's like, oh, you're a chiropractor, and they're all excited. But there are going to be those who say, oh, you're a chiropractor, and they might say that, oh, I hear chiropractors, whichever, cause strokes or, you know, break bones and all these types of things. Those are the rare things that happen that we have to, one, be aware that they can happen, but to realize that if we do a good job at treating our patients and recognizing when we should and shouldn't treat people with a manipulation, that we're going to minimize those chances from happening. The stroke one is probably the biggest area that we have our biggest just detractors. And my current understanding is that we have people who are coming in to see us because they have a stroke that's in progress. The number two symptoms that are occurring are neck pain and headache. And I'm sure you've probably had people come in with neck pain and headache. And you never know. One of them may have been somebody who had a stroke that was occurring, may have healed and never resulted in anything. Or maybe some have had a stroke, but they've never equated it to you. Whereas with a chiropractor, you're going to have a medical doctors asking the question in the ER saying, "Have you seen a chiropractor?" And I've had that happen. I've sent 2 patients to the hospital because I suspected that they might be having a stroke. Uh, I sent them there because I wasn't going to touch them and treat them, but that's one of the first questions they ask, and that's a biased approach, because we understand right now that whether they come see us or they see a medical doctor, the likelihood of them having a stroke, though it is exceptionally rare, even just without any care, the likelihood of them ending up having a stroke after seeing us or a medical doctor, it's virtually the same. And that's telling us that it's likely not our procedure that's causing it. We're seeing people coming in with a stroke that's in progress. Now, when they start having neurological symptoms, we recognize that. We send people off. It's the difficult ones is recognizing when those symptoms that are occurring are something more sinister.
Yeah, that's a tough thing to navigate, and I can see that where it's it was going to happen regardless, but because you had your hands on them, that blame is going to go, unfortunately, to you as the person having your hands on them right before that happened. And
Yep.
as somebody who works with women's health, I mean, that's the big thing with women's health is and pregnancy. You can't touch somebody who's pregnant because if something happens, then
Yeah.
regardless of whether or not it was going to happen, then that blame goes to you. I mean, it's come a long way, and they've done a lot of work on that, where we know that there's a lot more we can do with women who are pregnant to help them. But most of the reason why you can't, or why it's recommended to not work with women who are pregnant, is for that possible connection of a miscarriage after you've worked with them. Not because you've done anything that's caused it, but because
Right.
it was going to happen anyways.
Yeah, and you stepped in the middle of it.
Yeah.
Yeah.
Yeah, and it's unfortunate that that happens, right? And I think as long as we all understand our red flags and we clear our red flags and then we continue on, then we're good. But unfortunately, it's probably happened where somebody didn't clear their red flags and they continued on and something bad happened, and now we
And
all
vice
have to,
versa. There's people who have cleared and none of the red flags popped up, and a
yeah,
stroke occurs as well. So, I mean, and that's probably one of the biggest things that's, I think, scares some people away is we have a consent form, and you've probably seen the consent form at your office. Uh, it's a pretty scary sounding consent form. Like it goes from really simple stuff like, hey, you might be sore for a couple days to, okay, you might break a bone, you might injury a disc and you might have a stroke. I mean, it gets worse as we go along. I just had to educate people that, understanding that these are rare occurrences, and we do our best through our exam to actually determine whether you are in the appropriate, you're at the appropriate office, or should you be going to, medical doctor or whatever it might be. We just sent somebody off to their medical doctor for something that the person was having neck pain, and during the exam it was like, no, we're not sending you. We're not treating you. You're at risk, and there's something else going on. We need to send you off. So
Yeah.
just being, do your due diligence when you assess people. And I love treating headaches. And it's one of the number one causes of, related to stroke. So
Yeah.
we just have to be careful and aware.
Yeah. I'm really glad you brought that up, because that wasn't something I would have thought of asking you ahead of time. So thank you for bringing that up. That I think can be really helpful for understanding chiropractic care. And we should have you back on for a second episode where we talk about, like, really get into the nitty-gritty of how AT and chiropractic can work together and when to refer back and forth for that. Because I think that would be a great time, because I knew absolutely nothing about chiropractic care, except for you could have a stroke. um, until, until I'm not even kidding, right? Like, I only ever knew kind of those scary things, and that it was this bone popping manipulation, which I've since come to learn is completely wrong, right? Like, it's my perception of chiropractic care prior to working in a chiropractic office was completely different from what chiropractic care actually
So
is.
is mine.
And I think that if you've never seen a chiropractor and you have never had that experience, the only thing you're going to think about it is all of the negative things that we see on the internet and we see on social media. And yeah, we should do a second podcast where we talk about that and really talk about
Sure.
what chiropractic care is and how AT can work with it.
Cool. That would be
Yeah,
fun.
awesome.
Yeah.
Okay. So until then, if somebody wanted to get a hold of you or reach out to you and ask any questions, how can they best get a hold of you?
Oh, there's so many different ways you can find me. Um, Email is probably the easiest, which is info@drnotley.com, drnotley.com. I am on Instagram. It's probably the most used. I'm on there. My Instagram there is drnotley.chiro. I'm on TikTok, but I really don't post a lot there. And I think it's the same name. I'm on Twitter, which is just Dr. Notley, and I don't use it all that much, but I'll get notifications if people want to message me through there. I can't tell you what my LinkedIn would be, but it's there. And yes, I'm on YouTube. You can find me there, but you can't really communicate much with me that way. So, but yeah, I'm everywhere.
Yeah, and I'll add you've given me all those links. So I will put those in the show notes if anybody wants to reach out to you. And so again, the best way is to reach out to you through email. All of the other ways you should be able to see
Oh
it,
yeah,
but yeah.
I'm on there.
Yeah.
I flip through a lot, so.
Well, thank you so much for coming on again, and I look forward to chatting with you again soon.
All right. Thank you for inviting me.